Welcome to Med Medicine with Miss P. I actually filmed last week and I had some technical difficulties, so I'm going to redo that. And it's a shame because I know I'm not going to remember exactly what we talked about last week. I guess I could have rewatched it, but at any rate, I figured this December gift, this little Christmas season, I will give you a gift of the fabulous things that patients and doctors and nurses and students and everybody else has said over the years that really make me enjoy my job more than I should, I think. It's entertaining to say the least. So, and this is not making fun of them. It is merely pointing out the adorable things people say. Just like when I was little, I remember sitting on the little hand rest, kind of armrest console of the car, as you did in the 80s safely when you're 5 or 6. And we were going to buy a new car. And my mom said, "What kind of car should I get?" And I said, "A Commode." They all thought it was hilarious. I didn't know what they were laughing at. See, not dumb, just five. So these people aren't dumb, they just don't know what they're saying, which makes it funny for the rest of us. Like this one YouTuber I watch, he says he's IT, so you can't hear what the other person is saying, you can hear what he's saying, and he's like, "Okay, did you try shutting it off and on?" "Okay." "Well, what's it plugged into?" "Okay." "Well, what's that cord plugged into?" "A surge protector." "Okay, what's the surge protector plugged into?" "The same cord." Okay, so nothing's going to the wall. And you can kind of see how frustrated yet funny it is when people don't really know what they're doing or what they're talking about. So in this case, I have a wide range. I know we're not getting into the students yet, so y'all out there that you know that they're in the book, we're not getting there just yet. These most recent things are just stuff I've had to deal with lately after working a lot of pre-admission testing, things people say because they have no idea, and I wouldn't expect them to necessarily know this stuff. Some they really should, just like words in general. Like the patient told me she gets really bad nauseation with anesthesia. She gets the old nauseation. That's not a word, but all right. There's lots of people are saying words out there that don't exist, so that's okay. And I told you about the patient that told me that he had his gallbladder removed. He probably left the silver and bronze, but the gallbladder was in fact removed. It was a certain same person that told me they take Tramadol. It's like Ramadan, only less religious. And then this one was kind of sad, and I didn't know what to say about it. But she was telling me that she herself didn't have cancer or a history of cancer, but her sister has breast cancer in her liver. It's liver cancer. It metastasized from breast. At any rate, very sad situation. When they say stuff like that, it's really tricky for us because as a nurse, I can't say like, "Oh, I'm so sorry about that. How old was she?" Or, is she still around? I have to kind of move on. So I just sound like a heartless troll because if you let them talk, you will be on the phone with just the one person in your 10-hour day. Just the one. They'll talk to you for 10 hours if you let them. And then this other one, here's the thing that I don't understand. When I call a patient and I say, "Who's your emergency contact?" They'll say, "Rob Smith." Now, I already said, "Is Tina Smith there?" "Okay, may I speak to her?" So I'm talking to Tina Smith. I said, "Hi, Tina. This is the nurse. I'm calling to get you ready for the upcoming procedure. Who's your emergency contact?" And they will say, "Rob Smith, Smith." Well, I'm assuming it's the same last name. Like you spell your name that way, I'm going to go ahead and spell his name the same way, unless you're like Smith and Smythe and you just haven't changed it. They always spell the last name. Now, the first person's name could be Abubakar and they won't spell that, but they will spell the last name, which is the same last name as the person I'm calling. And I'll even tell them, "I printed off all the information you put in the computer, so I'm looking at their name that is spelled correctly." And they will still spell their last name for their husband because maybe it's spelled differently. I don't know. Um, don't even get me started on the med spelling wrong. Like they'll spell a med to me, and I'm assuming they're reading it off the bottle. They're not. They're reading it off the list that they wrote, and they spelled it wrong. So then they're telling me a medication that doesn't exist. Because as I'm thinking, like, do they mean amiodarone? Is it amlodipine? Where are you going with this? And I'm typing it in my phone, waiting to see, and there's no such med. So that's lots of fun. And you never know what they're going to say. Like yesterday, a patient wrote on her own thing in the computer that she can't take Bactrim because it causes vaginal bleeding. Not only is that not an allergy, but that's kind of what vaginas do. They're known for that. They they bleed. So I don't know that it was the Bactrim doing that as much as it was maybe your menstrual cycle. Or maybe she's past that and has vaginal bleeding. If you're on Bactrim, maybe it was for a UTI and the blood's not coming from your vagina. There's more than one hole down there. Just saying. Also, this little lady, sweet little gal, told me yesterday that she wanted me to warn the anesthesiologist because it's very normal for her under anesthesia for her blood pressure to spike. I don't, no, I'm not an anesthesiologist, definitely not even a CRNA, but I'm pretty sure we have the opposite issue there. Like we literally have them stop their ACE inhibitors before the procedure because their blood pressure ends up getting too low. As we all know how ACE inhibitors work, they stop your body from being able to vasodilate because they're stopping constriction. So when your body needs to dilate, it can't. So your with ACE inhibitors on board, it's stopping constriction. And if you need to constrict and you can't, then your blood pressure can drop too low. That's why we stop the ACE inhibitors. So I don't know if under general anesthesia, if your blood pressure spikes, that you don't have straight up like hardcore crazy hypertension. It certainly can't be from pain or nervousness like you all want to say, because you're under general anesthesia. Okay. And then I talked to this little lady from New York, and she called back and left a message, and she says, hey, I wanted to add to his record that he also has, you asked if there was anything wrong with his skin. He also has the purple legs, you know, when his legs are purple and they get real swollen. What's that called? Oh, that's right. It's stasis dermatitis. Yeah, that's the term used for someone in such severe renal failure, probably secondary to heart failure, where the fluid is so tight and so packed down in your legs and there's nothing there to move it. Your kidneys are shot, nothing else can really get it out of there. That the skin is so tight and taut that you literally like leak out, and the purple is coming from that like beginning of tissue death. It's not getting any blood flow. It's not blanching. It's hardcore. So it's not so much he's got the purple legs, it's that he's got the stage 4 kidney disease with severe heart failure, and it won't be long. But we're gonna go ahead and take care of him while he's here. My favorite last week, and I'm sad I didn't get that video out, is this patient. And patients do this all the time. They say, I say, you know, do you have anything wrong with your heart? And like, yeah, it skips a beat, or, you know, I have an arrhythmia. And I'm like, I don't know what beat you think you're skipping. And you can skip as many beats as you want. That as long as you have a P, Q, or S&T, that's fine. If you want to skip an entire complex, all right. But as long as you're functioning, I don't know what the skip a beat means. You know, when you're making out with someone you find very attractive, you can go ahead and do the skip a beat thing. But other than that, it doesn't mean anything. So this patient had a pacer defibrillator, and I asked why. So what was the underlying rhythm? You know, what was your arrhythmia? He's like, nothing. The doctor says my heart was fine. It was just in case. A prophylactic pacer defibrillator? You know, just in case. Just in case something might happen one day. No, that's not how that works. And I want to say maybe it was the same lady that called back or told me while I was on the phone with him, because it's always the wife and husband. They're on the phone at the same time talking over each other as I'm trying to ask these questions. Yeah, there's a good thing. There's nothing sharp in my office, because at some point I'm just going to put it right in my eye. She wanted to add the Sotalol inhaler. It's a Sotalol inhaler. It's an inhaler you use for when your heart is erratic. The Sotalol inhaler. You can't make this stuff up. I've tried. You can't. Even if you like think to yourself, I'm going to come up with something funny, you can't, because our brains don't work that way. Sotalol inhaler. Oh, here's another one. Every time you ask someone how much they weigh, they go, too much. Okay, I need a number. I still need a number. I don't care. If you think you have a weight problem, you should do something about it. Otherwise, can you just give me a number? I have 100 more people to call today. And there was, how tall are you? Well, I used to be. I don't care how tall you used to be. I need to know how tall you are right now. Just tell me how tall you are, and save all the humor that you think is funny another time. It was hilarious the first 5,000 times I heard it, but it's been almost 30 years now. It's not funny anymore. Just tell me how tall you are right now. And I know they think they're being funny or talkative or friendly. But after talking, there's the same patient over and over and over. They're all the same. They're all the same over and over and over. That one patient I get that's like, yes, no, nope, nope, Nope. Every time I say something, instead of just waiting for me to go through the line, they're like, nope, nope, nope. Okay. Yep. I know what time to be there. I know where to park. Okay. All right. Thanks. Bye. That's my favorite patient. Now I'm thinking he's probably like a serial killer that currently has, a woman in a headlock with his hand over her mouth, and he wants to get off the phone. Let's hope not. But like that's how he sounds because he's in such a hurry to get off the phone. But it's still my favorite patient. Just answer the questions. Don't try to be funny. Don't give me your life story. Just get to the point. Don't invent diseases you don't have to try to make it a bigger issue. This patient I talked to yesterday, one of the most articulate and easy patients to talk to ever, was just on top of it. And when I got to neurological disorders, he said that he has aphasia. Or he said, I think he said I'm aphasic. And I said, okay. I said, what do you mean? Well, like sometimes I just can't find my words and stuff. I'm like, okay, well, do you mean dysphasia? I think he said aphasia or something. I said, do you mean dysphasia? And he goes, no, I mean aphasic. Okay, aphasic, means opposite of, phasia, speech. It means you can't talk. You clearly can talk. He goes, well, I was diagnosed with global aphasia. Like, I don't know how global it is because you're as articulate as you can be. He answered every question better than like any patient I've ever spoken to. So I looked it up and I'm like, yeah, that's not a thing at all. I mean, not for him. It's a real thing, but it's not for him. Not even a little bit. I have no idea why he wants to insist on having that. I'm like, so do you have brain damage? What? Oh no, I just have global aphasia. Okay, does it come and go? Does your brain damage come and go? Or do you have little strokes or little TIAs here and there that it pops in and it pops back out? Because why are people inventing that? Why do they want to be sicker than they are? Is that's their identity, I guess? I don't know. This one lady also told me that she just takes the Lasix once in a while when she gets the swellage. Now, fortunately, my headset's so old and crappy that they probably can't hear me half the time, so I can just swing it up and kind of giggle to myself or write myself a note when I get something that good. Because swellage and nauseation, two different people. Swellage and nauseation. You can't make this up. Oh, one patient told my coworker, who I love, that the patient takes armpit thyroid. Yeah, that's the thyroid pill you take in your armpit. You just pop it in your armpit and you absorb it that way. It's the old armpit thyroid. I know she means armor thyroid, but I can't let that one go. That's good stuff right there. Armpit thyroid. Oh, and she also wrote on there that the patients can fill their own stuff out. So it says like the medication you're allergic to and what's your reaction. And she wrote sulfa and death. So the sulfa killed her, and then maybe they brought her back. If she takes sulfa, it ends in death for her. Okay, and that same patient is also allergic to the pen insulin. And you know what? Maybe she means the pen insulin, the insulin that comes from the pen. I don't know. It could be. I think she means penicillin, but it could be pen insulin. I'm not going to make fun of people how they spell. I can't spell. Can't spell purse. I finally got hemorrhoid down, and it took 30 years, but I think I finally got hemorrhoid down. Diarrhea is always 2 R's. That's why I remember now. It's always 2 R's. And that's pretty much the only words I can spell correctly. And the whole I before E except after C, that's not even true. That's not even true. I just took a little brain candy quiz with my husband at lunch last week, and we went through them, and sometimes it's E before I. It makes no sense. The English language is awful. Another patient was allergic to the ibuprofen. Ibuprofen. Not even ibuprofen. It's a bufen that's higher than the rest of us. Watch out for the bufen. Oh, and this is like an example of things that we get. And I know you can't really see, there's no information or personal information on this, but this is just like an example of things that they write out. I know there's like a glare here. I don't know if I can, but like they'll give us this. And I'm thinking like, that's great that you are so on top of it that you want to, write this out. So, you're logging it and you're, taking care of yourself. That is good stuff. Like there's nothing wrong with that. However, none of this makes any sense. Like not even a little. This right here, I'm going to start with this page next week because it's that good. Oh my gosh, and I can tell that the wife wrote it because she's always like, then they did this to him. It's so good that I'm going to start the next video with this. And I may even do a video sooner than later because since I missed last week, I did it, but I couldn't I couldn't get it out there, so I'm just mad about it because I screwed something up in there and then I couldn't put it on Facebook or YouTube. Anyway, so I think that's what I'm going to do. I'm just going to give you these little December gifts of fabulous things people say and do, because you can't make it up. And it's important that we share, so we don't want to just, you know, murder ourselves when you can't bang your head against the wall long enough for a patient to stop telling you the crazy things they say. And they insist medications are for this and not for that. And it's like a patient told me, like, I take clonidine, but I don't have high blood pressure. I'm taking it to wean off of Valium. I mean, okay, you know, I don't prescribe medication, but if you take 0.1 milligram of clonidine 3 times a day, it doesn't know that it's not supposed to affect your blood pressure. So it's gonna. And like it's clonidine, Catapress. If I licked a 0.1 milligram, I'd probably pass out from hypotension like within 30 minutes. And this guy takes 3 a day to wean from Valium, which is a skeletal muscle relaxant. It's not what clonidine does, but you know what? You can't even argue. Just write it down and let the anesthesiologist deal with it. And that's why they get the big bucks. And I don't, because I don't have to deal with any of that. And that's what's fair. So that's that. Same as always, face your fears, forget your failures, follow your faith. And maybe I can get another one out soon enough. Okay, bye. I hope. We'll see. Hey, did that work? No? No? Wait.